Hello, thank you for joining this poster presentation about our innovative online youth mental health program that is bridging the gap in Texas and beyond. My name is Amba Rios and I will be your presenter today. I am a health educator and mental health therapist for UT Teen Health, a program out of UT Health San Antonio. Again, thank you for joining. First, a quick disclaimer. The views expressed in written training materials, publications, or presentations by the speakers and moderators do not necessarily reflect the official policies of the Department of Health and Human Services, nor does mention of trade names, commercial practices, or organizations imply endorsement by the U.S. government. As we can see in these figures, mental health services and providers across the country are limited. In Figure 1, we see that of the kids in the U.S. who experience mental health difficulties, only 20% will access any mental health services, and of those 20%, only 1 in 5 will receive a full course of treatment. In Figure 2, all the areas in blue reflect a provider shortage area. In fall of 2020, UT Teen Health partnered with Dr. Jessica Schleider and her team of scientists from the Lab for Scalable Health at Stoney Brook University in New York. Dr. Schleider and her team created Project Yes, which stands for Youth Empowerment and Support. Project Yes is a series of 3 web-based modules that help teens learn new and healthy ways for dealing with difficult emotions and offers teens an opportunity to share their experiences with others. UT Teen Health then partnered with local school districts, community-based organizations, and youth groups to disseminate and implement Project Yes in English and Spanish. Our target population were youth ages 11 to 17 from San Antonio and the surrounding areas. Teens could access Project Yes anywhere they had access to an electronic device and with internet capabilities. Youth who completed the program also completed a pre- and post survey. Results. In our outcomes, we were able to collect the data of who participated and what method of referral was most successful. We also assessed how helpful the program was for not only youth, but for our community partners, and the impact sharing and participating in the program had on participants. As far as reach, 1,860 San Antonio youth began the program and 1,075 completed a 30-minute single-session intervention of Project Yes. The overall completion rate is considerably higher than completion rates previously observed for Project Yes. San Antonio youth also rated Project Yes as highly acceptable across all metrics, both in English and Spanish. The overall results indicate that Project Yes is an acceptable, accessible, and useful mental health support for English and Spanish-speaking youth in San Antonio. We are confident that Project Yes will continue to reach San Antonio youth and abroad now and in the future. Here are Project Yes intervention outcomes from pre to post outcomes, English. Hopelessness significantly reduced by 62%. This is the likelihood that a young person showed lower hopelessness from before to after participating in Project Yes. Self-hate also significantly reduced, 59.5%, and this is the likelihood that a young person showed lower self-hate from pre to post. And lastly, perceived agency. This significantly increased to 55.9%. The likelihood that a young person showed higher agency from beginning to end. Our Spanish outcomes also showed significant differences. For hopelessness, the likelihood that a young person showed lower hopelessness from before to after participating in Project Yes was 53%. For self-hate, we also saw a significant reduction. Again, this is the likelihood that a young person showed lower self-hate from free to post. This was 71.15%. And finally, for perceived agency, also a significant increase. The likelihood that a young person showed higher agency from beginning to end was 64.09%. In conclusion, by gathering information from youth and adults in the community, improvements can be made to existing programs and new programs can be created to meet other needs. The Project Yes San Antonio version is now being used as the main intervention and is being translated into other languages as well. While mental health continues to be a subject not openly discussed, it is necessary to provide opportunities for discussion and assessment of the need within communities. Project Yes has helped address mental health in various populations and not only aids in building skills, but also assists in encouraging perceived agency, which is necessary in healthy decision making. Thank you for your time, and we hope this has been a helpful presentation. We have provided our Project Yes social media toolkit and the QR code cards for you to share with your community. Thank you and enjoy the rest of your sessions.